I heard stage 4 cancer. I thought, okay, it's September. I'll get chemotherapy. I'll lose all my hair and I'll be dead by Christmas. That was just what I thought. In addition to liking to help people, I also like to be in control of things. So cancer really threw me for a loop because it was not part of my plan. So in May of 2021, I turned 60 years old. And I remember waking up on my birthday and having this feeling that this is going to be the best year of my life. But then about a month and a half later, I was working and I had an ocular migraine, which is, it's no pain involved. It's like you're looking through a kaleidoscope with the glasses white, and it maybe lasts for 30 seconds or a minute in one eye, maybe the other. I got referred to an ophthalmologist who ran a bunch of tests, including a CBC. Then a couple weeks later, I had this pain in my leg after standing up and didn't go away. I thought it was a muscle cramp. Turned out to be a partial blood clot in my leg. In the meantime, my optometrist suggested I get a physical because I was having all these weird symptoms. So I'd made an appointment to see my PCP. She ordered a CT scan, got the results back in my health portal. Of course, I open it and I'm reading these words like metastases and these scary cancer-sounding words. And like, wait, what? What's going on? And so I was able to get in to see my PCP, and I asked her, what are the chances that this isn't cancer? And she said, well, there's about a 1% chance that it's not cancer. Subsequent biopsy confirmed that it was non-small cell lung cancer, adenocarcinoma. I had a brain MRI that found metastases in my brain, which were causing the vision and balance problems. But I never had any lung symptoms. So it was a shock to me to have lung cancer. I mean, of all cancers to get, it was just a complete shock.
Her oncologist would make a key decision, and it would keep Maggie from having to go through chemotherapy.
My oncologist fortunately ordered a blood biopsy, and it was the blood biopsy that found that I had a mutation, an EGFR mutation, that had a targeted therapy pill that I could take. I don't remember her explaining about biomarkers, and she might have, but I just remember that those first few months, especially, I just felt like I was in a fog. It was, such a shock to have lung cancer. And then finding out that I wouldn't have chemo. It was just a different, but then the fact that I did have a mutation, and my oncologist had me get a second opinion from an oncologist at UCSF who was more familiar with my mutation and explained a little bit more about the mutation and guided me to some different groups like EGFR resistors, also Go-To Foundation, Lung Cancer Research Foundation. So that was when I also started my kind of quest for knowledge about lung cancer. I'm not an expert, but I sure know a lot more than I did 4.5 years ago. Biomarker testing is critical for getting patients the right treatment.
Doctors can determine the right treatment by performing biomarker testing. About 10 to 15% of non-small cell lung cancer diagnoses have the EGFR biomarker. That mutation can be treated with targeted therapy, a daily pill designed to find and shut down those specific signals.
I mean, like I said, it's not one size fits all. It's not just chemo for everyone, but you have to know what your biomarkers are. You have to get in the genomic testing, the next generation sequencing, the RNA, the DNA testing, because there are drugs out there that have been developed to target specific mutations. And if you have that specific mutation, then you can get access to the drug that's going to work for you. So it's not just just like throwing paint against the wall. It's a dart that's going, a little missile that's attacking your mutation. Biomarkers allow for personalized medicine because it's really about finding the right treatment for that patient at the right time. Any time that I've had progression, I've either, asked for a blood biopsy or since it had been a year since I had a tissue biopsy, I asked my oncologist last month, can we do another tissue biopsy since it's been a year? So because the tissue biopsies are the gold standards for biomarker testing for next generation sequencing, to really find out what's going on with the cancer, because a blood biopsy is only as good as what happens to be circulating in your bloodstream at the time. And so the patient and the oncologist need to be able to work together on, coming to an agreement on what that treatment will be, and educating myself on what drugs are important for what treatment, or for what drugs are important for what biomarker. Definitely ask your oncologist. If your oncologist isn't doing biomarker testing, then you need to ask for it. And so I started taking that pill in October, and surprisingly, by December, scans showed that there was no evidence of disease anywhere. Nothing in my brain, nothing in my lungs.
After 9 months on that treatment, the cancer showed new growth.
My upper right lobe.
Her team then turned to SBRT, or stereotactic body radiation therapy. It's an advanced, non-invasive method that hits tumors with high-dose radiation in just a few sessions. Despite these efforts, by spring of 2023, Maggie's scans showed further progression.
I developed a new mutation, a resistance mutation, a MET, M-E-T, amplification, and it's a resistance mutation that develops. And what was fortuitous was that at the clinic I was going to, there happened to be a phase 2 clinical trial that was opening up, accepting new patients for people that were in my exact situation, EGFR patients that had progressed on a TKI because of MET amplification. And then that worked for 9 months. And then a scan showed that the cancer had come back. So the site had grown more than 20 or 25% or whatever the cutoff was for the trial. So I got dropped from the trial. I had some more radiation, SBRT. I had some more scans in the summer of 2024 and more progression again. So the next option was to go on chemotherapy. Then in January of 2025, a scan showed that I'd had progression again. So that the chemo worked for a while, stayed on the targeted therapy pill. Then January, more progression. I've had lymph nodes that have shown that I still had the MET amplification in addition to EGFR. So my doctors knew that we needed to treat both of those mutations in order to be successful in pushing back the cancer. That was my 4th line of treatment, as I would call it, and just started my 5th line.
For Maggie, it was critical to make sure she was getting the right tests. She says that helped open up more treatment options.
Another test that my oncologist did was IHC testing. So you do FISH testing to get the MET amplification, and you can do IHC testing, and that tests for overexpression. So in addition to amplification, I also have MET overexpression. This one actually opened up a new line of treatment, a new drug for me that will work better for me because it targets the overexpression. So going on that and then back on another drug to target the EGFR mutation. So I've gotten used to seeing progression in my scans. I used to get really freaked out with the scans, but I don't so much anymore. I look at it as it's information. It is going to, if there's something going on, it's going to help direct my oncology team and me to figure out next line of treatment, what the next step is. And I'm always, hopeful that there will be that next step. When I had progression again at the beginning of last year and is like going into my 4th year. Then I switched my care to one of my specialists who was a thoracic oncologist. But I figured if this far in, I really want to be with a lung cancer specialist. And so my oncologist and I, we make the decisions together. So I'm so appreciative of my oncologist and just the input that I have, because it's ultimately it's my life, and if he doesn't agree with something, he explains why he doesn't agree with it. So it's not like I always get my way, but I do feel.
Maggie's lung cancer diagnosis reignited her love for helping others.
Not long after I got diagnosed, I signed up with an organization that does peer mentoring for newly diagnosed lung cancer patients. And so that's how I kind of started my personal advocacy, helping other people that were going through a similar experience that I'd gone through, kind of, helping them navigate that unknown that we all feel at the beginning of a diagnosis when we hear those words, you've got cancer. Being with other people in your mutation community, you learn from them. I can also give advice to them, and not medical advice, but hear from my experience. These are the lotions that I've used that have worked really well on this skin situation that I had. Be sure and ask your dermatologist first, but so it's so you don't feel alone, like you're the only person with this this situation. I mean, I've met so many amazing people since getting diagnosed with lung cancer. I've chosen to look at lung cancer as, what am I going to learn from this? So I don't look at this like, oh, woe is me. I mean, some days I feel that way, but mostly it's like, what can I do to live my best life? And what can I do to be fulfilled? I mean, that's kind of the crazy thing. My life is so much more fulfilled now than it was before I had lung cancer. I have gratitude now that I didn't have before I got diagnosed with lung cancer, because I know now what it feels like to not know if I'll have tomorrow or, next year. Hope to me means a good future. It means research. Research means hope. Hope means research. Without research for new drugs, for new treatments, then treatment comes to a standstill. I mean, I've been on 2 different drugs that weren't around when I was first diagnosed, and even how my mutation is treated. It's treated differently now for newly diagnosed patients than it was 4.5 years ago. Hope is so important, because without hope, what is there? There's something I learned through meditation, that the blue sky is always there. It's covered by clouds sometimes, but the blue sky will always come back. You might be feeling hopeless in the moment, and it's important not to ignore those feelings. And you've got to live that. You've got to lean into those feelings, but that's not a forever feeling. You will feel hopeful again.
As someone who has faced cancer as well, Maggie, thank you so much for sharing your story with us. If you were inspired by her story, we've queued up another lung cancer story for you here. And please make sure you subscribe here to the Patient Story community, where we're always reminding people you're never alone.